The following is a surgical technique video on medial meniscal root repair by Drs. Paul Caldwell and Chad Lavender of Orthopedic Research of Virginia. We start by viewing through the standard lateral portal and probing the meniscus through the medial portal. You can see here the unstable meniscus root, and it is important to include this portion of the meniscus in your standard diagnostic examinations. A 0 PDS will be used to shuttle the sutures through the meniscus, and here you can see a standard curved suture passer is used to shuttle the PDS through the meniscus. Here you can see as the free end of the PDS is retrieved through the medial portal. The free end of the PDS is then tied around a size 2 fiber wire suture, and the other end of the PDS is then pulled, and this will bring the fiber wire through the meniscus tissue in standard shuttling technique. We then prepare to create our horizontal mattress by shuttling a PDS through the meniscus more centrally. This is then grasped and pulled out of the medial portal, similar to the first PDS. The superior limb of the PDS will then be used to tie around the superior limb of the suture, and we will pull on the inferior limb of the PDS, bringing a horizontal mattress stitch through the meniscus. A simple stitch will be placed medial to the horizontal mattress in similar fashion using a PDS to shuttle. Next, we use a curette to prepare the repair site and debride any soft tissue. Here you can see a standard ACL tibial guide for our guide pin and flip cutter insertion. You want to visualize drill entry into the knee joint, and after you can see the tip of the drill, you can then flip your flip cutter. Next, you can see we start our flip cutter off of the bone, and we drill our tibial socket in retrograde fashion using the flip cutter. We then used a nitinol suture passer to retrieve the sutures through the tibia. We placed the nitinol suture passer up through the tibial socket and retrieved it using a looped grasper through the medial portal. The sutures were then shuttled back through the tibia in standard fashion. The sutures will then be tied over the anterior surface of the tibia, and here you can see our final repair. This is a modified Mason-Allen type suture, and it is important to see nice compression of the medial meniscus into the repair site, as you see on the video.